The chair moves that House File 478 be recommended for referral to the Committee on Ways and Means. We have the bill before the committee. Representative Erdahl, welcome to the committee. Please present your bill.
Thank you, Madam Chairman and Madam Chair. And pleased to be here today. I believe in my 17 years in the House, this is the first time that I've been honored to be before an HHS committee with a bill.
No. Very nice.
Treats.
Hello?
HF 478 deals with a very serious issue that is coming before us, the post-traumatic stress disorder, dealing with firefighters. And this bill is asking for $400,000 to create a grant program that gives $150,000 for grants targeting the training of service dogs. $100,000 is for grants targeting education and support for spouses and families, and $150,000 for grants targeting the delivery of mental health services, including treatment and appropriate referrals. I was recently notified of concerns that State Auditor Julie Blaha has regarding this issue. She recently put out a report on the 2017 Financial Investment Report of the Volunteer Fire Relief Associations. And in that report, she says, while we are happy with the health of the funds, we are concerned with the health of the firefighters. We will continue to monitor the magnitude of survival and disability benefit payouts and their financial impacts on these pension funds. The amount paid in survivor and disability benefits increased by 101.1% between 2016 and 2017. So this is a serious problem that is dramatically getting worse. And I have with me today Matt Doedy of the Dassel Fire Department.
Thank you. Please state your name for the record officially and proceed with your testimony.
Madam Chair, my name is Matt Doedy, President of Firefighters with PTSD, which is the organization that is requesting the funds. Essentially what we do is we broke our organization down into 3 different segments, 3 different pieces. We were formed by a group of firefighters dealing with PTSD, so that's where the name came about. We are actually an organization that serves veterans and all first responders, and I mean from corrections officers to ER nurses to you name it. We, if they come to us and want a service dog, which is really hard to do, we try our best to work with them. Now, we have created several tracks on our dogs, and we have several professional trainers as our partners who help us with this, but for veterans, they like to get their dogs a lot sooner because as a part of their therapy, they work with the dogs. If you've heard of Eagle's Healing Nest, Off-Leash Twin Cities Canine Training works directly with them and is partnered directly with us. So we're very closely tied with them. We do a lot for the veterans. When it comes to first responders, we do the same thing. The service dogs is a huge piece to what we do. But the more important piece that we wanted to focus on is we want to provide training for free and put the resources in front of family members that have first responders and veterans that are in our line of work. Because I feel like our families, our board rather, feels like our families are going to see the signs a lot sooner than we're willing to even admit that we may have a problem. So we're going to curb that suicide rate. The other part of the education and prevention is also helping with I can't afford it, or it's getting expensive, and my wife told me if you didn't have to pay for that copay, we could have taken a family vacation. We're trying to remove the issues that are causing people not to get help. In the first 2 years, I myself and some others have privately funded the work we've done. We've placed 1 service dog, and we are on track to place our 2nd this July at an event. And everything we do, we try to keep right here in Minnesota.
Thank you so much for your testimony. Is there anyone else in the audience who would like to testify on House File 478? Is there discussion from the committee? Yeah. Representative Albright.
Thank you, Madam Chair. And to the testifier or to Representative Erdahl, I know that work comp went through a very extensive review of PTSD for emergency service personnel and adopted language into the last work comp bill in the last biennium to support the work of recovery and healing. I'm just wondering, this is not to supplant that work, it's a complement to it. And I'm just wondering if you could speak to how the work comp arrangement has been assistive to those folks, and where does the baton handoff occur in some of these circumstances?
Mr. Doedy or Representative Erdahl?
Mr. Doedy.
Representative, I think right now where we're at with that is that bill was passed last year, and I believe it's in language writing. Now, I'm not up here in too much of the know, but I believe that's the last I heard. I do have firsthand experience of guys who we have submitted a claim due to this and have sent to treatment, and it was denied in 2 days. So we're still seeing the denials, and I'm sure that's because they have to, decipher how far do we go back, what will we cover, how is it covered. And as far as us as an organization, we try to allocate a certain a percentage of the person's bills. If they say, hey, I need treatment, it's going to cost $5,000. We try to get them a percentage of it, but then we also network with other nonprofits to see if we can't help get most of it covered. That way, when they're done fighting work comp, whatever's left, we try to just lessen that burden for the immediate sense.
Representative
Madam
Albrecht.
Chair, and thank you for that information. I'll pass that along at our next commission meeting for work comp. So thank you for that information.
Representative Liebling.
Thank you, Madam Chair. And Representative Erdahl, welcome to Health and Human Services. I'm glad you finally made it. It's great to have you here. So, Representative Erdahl, and to the testifier, I think the problem is extremely serious, and we've learned some about, especially about firefighters. We've heard bills about higher rates of cancer and all of the things that firefighters have to deal with. And, certainly we would like to be able to help address that. But I have some kind of questions just about how this would work, if you don't mind. First of all, I'm not that familiar with the whole thing about service dogs. And does a service dog, is there a prescription for a service dog from a mental health provider? Or does a person just decide, I'd like a service dog, I think it would help me? Or just how does a person get to that point of getting a service dog?
Sure.
Mr. Doedy.
Representative, I think how I'll answer that question is simply we work directly with the person that's asking for the dog, our team does, and then they also request a verification from their doctor or provider. So we do recommend that as a part of this process, because obviously we opened our application process up for 2 months out of the year. We had 211 applicants. We've been here for 2 years. So in 2 months, we had 211 people with doctor's notes saying, can you help me? I think also a part of that is with psychologists. Some of the dogs are not all the way to a service dog level. They're either ESA, which is emotional support, or therapy, which brings them a different level of comfort. The service dog level is for someone who, with PTSD in this sense, may need help reminders to take their medication, and the dog on their vest has spots for the medication with them. There's many different tasks that they can be tasked with. One of the big ones that we're seeing is nightmares and being in big crowds. People get anxiety with PTSD and they feel like they need to be near an exit. So the dogs bring comfort and healing in many different ways, and most often it comes with the long-term working with the dog, developing that relationship. And
Okay.
Chair Liebling?
Thank you, Madam Chair, and thank you for that answer. So now I realize I know even less than I thought I knew. And so is there a definition in statute of what a service dog is? So when the bill uses the term service dog, from your answer, I'm understanding that has a specific meaning, and there must be a definition in statute somewhere of what that meaning is?
Mr. Doedy, or should we call on House Research?
You can call in-house research, but I'm sure there is because we can't just put out any dogs. They test out, they go through many
Okay.
certifications. So it's,
Chair Liebling.
Thank you, Madam Chair, and thank you for that. And so, and then my other question would be, is there, and I don't know if you don't know the answer, that's fine, but, we're trying to, of course, we're going to have limited resources to do things, especially new projects, and we want to be able to use our money where we have evidence that something will really have an impact. And I'm just wondering if if there are studies that show how well the service dog works. Is there any research on that we can look to say that this approach is better than another approach or anything like that?
Mr. Doedy.
Madam and Representative, yes, there is tons of research out there that you can find. At our last Senate hearing, we had our professional trainer, Becca, was with us, and she did talk briefly about that. There are a lot of statistics that show they help folks deal with and live with PTSD post-treatment. So now they've gone through treatment and maybe they're on a medication, and what does life look like? Adding that dog in at that point when they're stable and they know what they're dealing with has helped leaps and bounds. Some even return to work.
Okay, thank you, Madam Chair.
Representative Fisher.
Thank you, Madam Chair. To Representative Erdahl and our testifier, thank you for bringing the bill forward, and to the testifier, thank you for your service. I appreciate this being done. I've followed our local firefighters, our local fire department. My son is on the paid on call. He's also full-time on another fire department. So this is an area that I've been paying more attention to over the last couple of years, and I've heard a lot of the problems out there with PSTD and everything else, and I appreciate the fact that there's more being done in this area, and I'm very supportive of the work that you're going to be doing on the bill here, and want to make sure that we get as much of this out in the community as possible. It's a serious effort. You never know when it's going to present itself, and when it does, the quicker we can get treatment out there, the better chance we have of recovery. So I want to support your efforts and encourage you to keep up the good work.
Representative Edelson.
Actually, I was just going to speak
Pass.
to that was, but you know what? Actually, while I have it, thank you, Chair. Just to piggyback off what you were
Never give up
saying,
the
there are
most there.
there are qualifying conditions in terms of service dogs, and there is very special training. And somebody that has worked with kids that have autism and things, they are. We have passed statutory language that the dogs have to go through a certain training to actually be qualified. And so I'm very honored to be a co-author of this bill, Representative Erdahl, and thank you for bringing it.
Further discussion from the committee. There being no further discussion, the chair renews her motion that House File 478 be recommended for re-referral to the Committee on Ways and Means. All in favor, say aye.
Aye.
Opposed? The motion prevails. House File 478 is recommended for re-referral to the Committee on Ways and Means.
Thank you very much.
Congratulations.
Thank you.